ultrasound is using high frequency sound waves to create a picture. So a little bit of the history on that. Back in the late 1700s, they decided to study bats and how they could see at night without being able to use their eyes. And so that was echolocation that they ended up then following up and trying to figure out how we could use that in everyday world. Then in World War II, it finally came to fruition, and they used sonar in the submarines to be able to detect anything underneath the water. And so it's kind of crazy that we're using the same technology today that they used in World War II. Just a little bit more advancements have come since then, right? So ultrasound, I think, is pretty amazing, that I can sit here and I can put this little plastic probe on your belly after I squirt some gel on, and I can see into your skin, which is really kind of cool. So what happens when we put the ultrasound probe down, it sends out pulse waves of sound that are then bouncing off of different structures in your body. And depending on how dense those structures are, depends on how fast that comes back to the probe, that signal, and that's what creates our picture on the ultrasound machine. Even though it's amazing, we do have limitations. So ultrasound, we can't see through air and we can't see through bones. And I know during pregnancy you think, okay, well, my baby has bones, like how are you going to see through that? Well, it takes a while during pregnancy with baby forming for the bones to ossify and then create shadows where we can't see through it. So ultrasound, all in all, is an amazing tool. It is, but we're just one small piece to the big puzzle, the big picture of your baby's well-being. So there's one statistic out there that 50% of pregnancies where the baby is born with Down syndrome had a normal ultrasound. So if your physician is recommending doing other testing, other blood work, we do encourage you to do those things, because those are just going to give us more pieces to our big puzzle. Typically, in a normal pregnancy, you're going to get 2 ultrasounds. You're going to get one in or as close to the first trimester as we can get you so that we can give a dating for the pregnancy. The second ultrasound you're going to get is around 20 weeks, and that's the full anatomy scan where we look at everything with baby, all of the structures. So typically in pregnancy, there's 2 types of ultrasounds that can be done. One is transabdominally, which is on top of your belly, and that one we use this probe. And then the next one is transvaginal. So the ultrasound probe goes into the vagina. This does not affect baby. It's not going into your uterus, only in the vagina. There are a couple of different reasons that we would do the transvaginal ultrasound. In the first trimester, we would do the transvaginal depending on the position of your uterus and how far along you are in the pregnancy. So this is also going to lead back to our first question with not being able to see through some of the things. So our pelvic organs are all right in the middle of all of our bowel, which all of our bowel contains air, right? So we ask that you come for all of your ultrasounds with a full bladder. I'm not doing it because I want to torture you. I've been there, I know, but trust me, it's going to help, because once we have a full bladder, that pushes some of the bowel out of the way so we can see what we need to see. If you come in for a first trimester ultrasound and you don't have a full bladder, what I might have been able to see with a full bladder, I'm not going to be able to see now because of that air in between. So then we may have to do vaginal just so we can get the better pictures. During different points in the pregnancy, there are other reasons why we may have to do a vaginal ultrasound as well. And I know that some people are confused by that, because you think, okay, well, I'm already out of that stage. Baby's big, why would I need to have that done? So to check the cervical length. So if you have any kind of history of a preterm labor, or if you've had a history of a LEEP procedure, we want to make sure that the cervix, which is keeping baby in there, is still long enough where we're not going to have to worry about any complications down the road. The second other reason that we would be doing this would be because we want to make sure that the placenta isn't over the cervix. The placenta can be anywhere inside of the uterus. The only place we really don't want it is over the cervix. The answer to that one is no. So I know everybody wants to know. So the issue that we have with ultrasound, especially in the first trimester, this is when all of your baby's systems are developing and growing. And if I'm going to listen to your baby's heartbeat, I am putting all of the energy from this big machine into baby's tiny little heart, and I'm not going to do that. So as soon as you get far enough in the pregnancy, typically around 12 weeks, the providers will start listening to your baby's heartbeat with a handheld Doppler, which is safe. Now, the farther along we get in pregnancy, if baby's in a bad position and flip the wrong way, I may have to use the Doppler to listen to the baby's heartbeat, but we won't do it for any extended period of time. It's a quick get the heart rate and get out. But we will, at every ultrasound, we will tell you, we watch the heartbeat, we measure it, and we'll tell you how many beats per minute. If you have an appointment with your provider the same day after your ultrasound exam, you will get the results at that appointment. Otherwise, what's going to happen is as soon as our doctor reads the ultrasound report, it's going to be sent into MyChart, and they'll usually send you a little message along with it. But they will also go through it with you at your next appointment. No. So Lee Health has a policy here that we don't allow photos, audio, or video recordings in the ultrasound room. The reason that we have this policy in place is because this is a diagnostic exam, and we know that not every pregnancy has a normal outcome, and so our physicians need to be able to look at all of the images before so they can provide a diagnosis. Okay, so even though we say that we can't take pictures or video in here, we as ultrasound techs are going to do our very best to give you pictures that you get to take home and you can keep. So with that being said, there are times that we know that babies aren't always in the best position. So there's outside factors that have to come into this. So when you come in for your ultrasound, we want you to know that there's a couple of different tips and tricks that we might try to do. So almost every single ultrasound, we're going to be jiggling your belly. So just to try to get baby to turn a little bit. Another thing that we might do is we may have you get up and go to the bathroom. Another thing with filling that bladder ahead of time. So if you come in and it's empty, I don't have that tool that might be able to help get baby to move. We'll be rolling you from side to side, possibly drinking some cold water because sometimes that gets baby to move. So yeah, we're going to do everything we can to be able to get you good pictures because I know that's important. This is an exciting time in all of your lives, and we get it.